All right. So, namaste everyone. Thanks a lot for joining us. Good morning, good evening, depending upon where you are. We are here today to talk to Dr. Sunil Joshi and Dr. Shalmali Joshi ji. They will be coming to Ayurveda Gurukulam middle of next month to conduct a 3-day seminar. The first day would be on 17th, the Friday, and the next 2 days, 18th and 19th, will be the continuation. So we'll talk a little bit more about that. Before we get into that, let me just take a minute and do the opening mantra, and then we'll start. So please bring your hands together, closer to your chest. Close your eyes. Bring your focus on the hollow space between your palms. Take a deep breath in. Om Gam Ganapataye Namaha. Om Gam Ganapataye Namaha. Om Gam Ganapataye Namaha. Om Sahana Bhavatu Sahano Bhunaktu Sahavir Vavahai Tejasvinavadhi Tamastomavit Vishavahai. Om Shanti Shanti Shanti. Hari Om. Shri Guru Bhyo Namaha. Om Tat Sat. All right. There's Jonathan. Thank you.
Good to see you.
Yeah, good to see you too. So Jonathan,
Joshi, Shalmali, nice to see you.
Hi, namaste. Nice to see you.
So Jonathan, before we get into the discussion, I just want to take 2 minutes out and inform everyone about the upcoming course or upcoming webinar or seminar that we'll be conducting. So let me quickly.
Excuse me, Saurabh, I cannot hear you properly. The sound is not that. Yeah.
I see. I'm sorry. Jonathan and
Speak a little loudly. You're speaking a little low. That's what I feel.
Okay. I'll try doing that.
I know.
All right. Yes, let me do that. So let me just quickly share.
It's better.
Yeah. Okay. So as I was talking about, we have this seminar coming up middle of next month. So on 17th of June, Dr. Shalmali Joshi will be teaching a course on the women's health. Right. So let me just open that quickly here. So this is a 1-day seminar for women's well-being that will be taught by Dr. Shalmali Joshi. That is on Friday, the 17th. It will be a course that it will be a session that will be happening at Ayurveda Gurukulam in person. There will also be a live streaming that will be available for people who are not able to travel to Ayurveda Gurukulam. A little bit about Dr. Shalmali Joshi. You can see that on the website as well if you are able to go there. She and Dr. Joshi are both a long-time Ayurveda practitioners. She graduated in 1984 from Sri Ayurveda College and Research Institute from University of Nagpur. She has been practicing Ayurveda as a doctor, as an Ayurvedic doctor since then. She along with Dr. Sunil Joshi is the founder as well as the operating director of Vinayaka Panchakarma Chikitsalaya, which is located in Nagpur. It also has a branch in Albuquerque in New Mexico. There are a bunch of other achievements that I would probably not do justice if I just read the pro forma over here, so I will not do that. But please look at it. And Jonathan here is with me, who has been associated with both of them for quite long. And Jonathan, I would probably lean a little bit on you to talk a little bit more about your personal experience with them. And before we get into that, just as a quick thing that on 17th we have the women's health session, and on 18th and 19th we have the Doshas, Dosha Management and Panchakarma Chikitsa session with Dr. Sunil Joshi. That would be over the weekend. So with that, Meenakshi, if you want to talk a little bit more about these sessions, or if I missed anything, please do that. Otherwise, I will hand it over to you, Jonathan, to talk a little bit more about Dr. Sunil Joshi. I don't think I will do justice as much as you can do talking about him. I will share the screen here, but I would let you talk a little bit more about him.
Okay.
I will just add one thing sort of to this. There is for everyone, the consultation with the Dr. Joshi and her wife is available for a very limited time. So do go on the site, do your book your consultation if you really want to. We prefer people coming in Ayurveda Gurukula. So that's a first preference. So if you are coming, do plan to come over there. The couple will be traveling a long way to see you. So we will be really looking forward to see you there. And we are really looking forward for the grace and the blessing of all of this years which has passed through. So we are looking forward to that. So with that, I think, Dr. Sunil Joshi can talk more about it, what he is going to cover in the sessions. And with that, I will pass it over to Jonathan to start with the interview as well as sort of ask your questions.
Well, thank you, Meenakshi. It's a pleasure to talk about Dr. Joshi and his wife, Dr. Shalmali Joshi. I met them back in 1991, I believe. And at the time, I was familiar with Ayurveda. I had the basics down. But what struck me was his incredible clinical knowledge. And of course, his specialty is Ayurveda. And so he really introduced me to Ayurveda. I went to India, did long sessions of Ayurveda with him. And then, I helped him with his book, Ayurveda and Panchakarma, The Science of Healing and Rejuvenation, and learned a tremendous amount about Ayurveda and particularly Panchakarma and why it works. And the book has been very successful. It's now been translated into 7 or 8 different languages. And he continues to travel the world doing his clinical work as well as Panchakarma. And he's got a beautiful clinic in Nagpur, Western style clinic that people attend all year round. So I don't know what more to say, except that both of them are really expert doctors. They know a tremendous amount about Ayurvedic science. And I guess one of the things I'd like to ask Dr. Joshi at some point, it doesn't have to be right away. Let's see how it fits. This question fits into the whole flow of things, but about Ayurveda in the West. What does he feel the future of Ayurveda is, particularly in this country, in the United States, that takes on things quite readily? And what does he see happening with the science of Ayurveda? So why don't I turn it over to you, Dr. Joshi? And of course, Shalmali, you can chip in anytime you want.
Sure.
But let's hear from both of you.
Yeah. Thank you so much. And namaskar.
Namaskar.
Namaste, everyone. Yeah.
And highly appreciated Arsha Vidya Gurukulam, Rakesh ji, Saurabh ji, and of course, Meenakshi ji for taking efforts to arrange this interview. And basically, we are just a clinician, as Jonathan was saying. We are not academician. We are not like professors and, teaching. It's not like my forte. Our forte is to work with patients, help them, see what you can do to get them better. This is all our basic intent with Ayurveda, nothing else, purely. And I think that is what we are doing all these years, whether it was in India, whether it was in Europe, whether it was in United States. And regarding this course, which we are going to take up, is basically a gist of our clinical experience we're going to share with all of you. is how it is so critical and so important to understand that how to be healthy. Healthy not only from the physical point of view, but emotional point of view, the subtle body, which is the mind, which is the most critical. So both these mind and body, how to understand them, how to work with them, who makes them work better, who make them balance, and who controls their functions and get them going better and better. Because in Ayurveda, they clearly mention, very clearly, majority of the diseases, if they manifest inside the physical body or in subtle body, it's basically because of function of the mental functions or cognitive functions get affected, or various emotional issues, and that is what causes the various type of ailments created a problem in the whole body or in systemically. Same way, the other reason for any diseases manifest inside the body is chronic digestive problems, a problem related with the guts, problem related with, according to Ayurveda, Agni. There's a very one-liner statement made by our text, which is called Charaka Sanhita. As somewhere, I think you or Saurabhji is asking a question about authentic material or information about Ayurveda. I think the authentic text on Ayurveda is Charak Sanhita, which is what our Bible. We learned that, we studied that. It is the two-part Charak Sanhita, which has got more than 6,800 sutras, and it's in Sanskrit, but it has been translated in Hindi also, and now it is in English also. It is our really a textbook. It just tells you one sutra, but between the line, it tells you the whole information. What does that means? So when they make a statement, Sarve Roga Api Mandagno, what does that means? Sarve Roga, majority of the ailments which manifest inside the physical body or emotional body. Manda Agni, that is low or weak digestive fire, is a basic root cause of the problem. So that means you take care of your digestion, you take care of your digestive system, you take care of your digestive fire, and things will not manifest as a disease process. Because according to Ayurveda, disease progress inside the physical body or even in a subtle body in 6 stages. And up to 4th stage, you have no clue whatsoever on today's all these gadgets, what is available for investigation. So for invasive investigation, blood test, urine test, MRI, CT scan, whatever you talk about, they wouldn't pick up. But yes, this subtle science, which give you a clue at a very early stage to pick up the seeds where they are manifest, get them out of the system. For that, they give you a beautiful link to understand this science of Agni and science of mind. And
So-
both are the root cause of any disease, according to our clinical practice, what we have seen.
So Dr. Joshi,
Because-
what the West is saying is that 85 to 90% of illness is psychosomatic. So you're saying the same thing. It starts in the mind.
Yes,
And then,
it starts from the mind and it starts from the mistake of intellect.
Yeah.
They use the word for that, pradnya aparad. That I know this is not good for me, but still I indulge into this. So consequences are going to be there. That is called mistake of intellect. You know that in your intelligence that this is not good for me, or I'm not supposed to do this way. I'm supposed to do this way. But then you still do it. And then eventually it creates manifest various issues in your subtle mind or subtle body.
so low Agni creates poor metabolism, poor breaking
Yes.
down of the food, and that
Exactly.
unbroken down food can't nourish the body, and it creates what they call ama or
You got it.
toxicity.
So the word ama means undigested. What is not will be accepted inside the territory of the body. The substance which is not useful for the body, which is not accepted inside the body, which is not well digested, which is no more useful, need to get rid of the body, And that is why it's called ama.
Hmm.
And this ama, whether it's a physical ama or emotional or mental ama, if they manifest, they sow the seed of the disease. And when that disease starts progressing with etiological factors, various diet, lifestyle, so-called stress is the commonest word for that. And when that keep going on, then this disease process keep going on. And eventually you get a diagnosis. By the way, you got arthritis. By the way, you got insomnia. By the way, you have a degenerative disease. By the way, you have allergies, all kinds of diseases. But their baseline is here, according to Charaka. And I think that's what I wanted to promote to my Ayurvedic audience.
Hmm.
How to understand this concept of Agni. How to understand this concept of emotional Agni and physical Agni.
Hmm.
How to take care of that. Who is the link between this mind and body? Who really helps us there? And I think that is the title of my workshop, our workshop rather, Dosha Management. That it's my beautiful wife, my better half, is also been part of that. And we both are going to discuss these issues. So basically what we're going to discuss, what I feel is understand, explain everything about doshas. What is dosha means, where it come from, how they work, how they are available outside in the universe, how they are available inside of us, how they are available around us in the form of plants, vegetables, fruits, grains, you name it. Everywhere you will find them, and their signature presence will be there. And I want to teach all that information to you in this workshop.
Wow. that sounds really fascinating, Dr. Joshi.
So this will, though this will be a explanation about, clinical explanation about various type of ailments, but it will be a very useful workshop for people who have a basic issues with their digestive system, basic issues with their emotional problems. People are fighting with that nowadays. It's hard for people, you know. Number one pill nowadays is selling all over the world. I'm not talking about just United States, all over the world is a sleeping pill. Why we need that? Sleep is a natural mechanism. Nobody trained us how to sleep. We know how to sleep. But when you lose that training, when you lose that inbuilt programming inside, there is something went wrong inside of you. What is that? I want to teach you that. And according to Ayurveda, for longevity, you need most importantly good sleep, good diet, which is called ahar. That's where Shalmali is going to focus on. And most importantly, along with that, understand the stability of elevated sattva, a quality of the mind. If that gets stronger, automatically you are able to handle any stress, any emotional situation in a much better way. So it won't allow you to get victimized by the emotional situations and get affected with symptoms. It's like anxiety. Oh my God, it's like an epidemic now. People are so anxious. People are so nervous. Means it's like out of 10 now, 8 people, 7 people, I found out that they are battling with anxiety. And there's some people has to take a medication for that. And that is getting further and further. Medicines is not a solution. Solution to understand the balance between this mind and body. So that is why there are 2 basic understanding we need to learn about: how to take care of Agni and how to take care of the mind, how to elevate the sattva. And I think we're going to talk about this in our workshop. And the link for both of them is doshas. So we'll be elaborately talking about doshas. And so this will be very good for anybody who wants to learn about themselves. That what can I do for myself to get better? So this will be our efforts. We will try to make it much simplified way to get this logically explained and give it the information to all of you, because that is our job. And this is coming not from us. This is coming from the text. Directly from Charaka, we're going to communicate to you.
Dr. Joshi, could you very briefly describe for some of the viewers who don't have much background in Ayurveda, the principle of the doshas? Because it's so key to Ayurveda.
Well, I'll be elaborating that whole information in workshop, but basically dosha means a concept which is a unique concept only elaborated by Ayurveda. No other science recognizes this. Everybody is just focusing on structures of the body, physical structures of the body, but as nobody is looking into the entity which programming the structures of the body. And that is why we call them doshas. Dosha means uniqueness. Dosha means not fault or default. The dosha entity means a uniqueness. A uniqueness each and every person expresses out. We know each and everybody by according to their natures, according to the way they talk, the way they behave, the way they expresses themselves, we recognize them. Oh, that Jonathan, oh, he's a lovely man. He talks about this, he talks about that. Like it immediately comes to you. So this uniqueness, whatever is that personality holds, is recognized by doshas. And doshas is a inherent intelligence which is programming this physical body, my friend. So physical body is a practically hardware, completely programmed by the software we can call in today's language, doshas. So what is doshas? Doshas are nothing but the elements which is in the nature, in macro form, in micro form, in subtle form, they work inside of us. And we'll be talking about that.
Yeah.
And that's why we call them Pancha Mahabhutas, 5 cosmic elements. I talk that in my book also. And I will encourage people, this is not to promote my book, be honest to you, but if you really want to learn about Pancha Mahabhutas, please have a look of chapter on I elaborate about Pancha Mahabhutas. I really gave a detailed understanding about elements because that's where I learned about Ayurveda. That's where I understood that if I want to be an Ayurvedic practitioner, I better be focusing on doshas. Because if I know how to take care of doshas, I can take care of the emotional status of the mind and I can take care of the Agni also. And that is why doshas is very critical. And they come from Pancha Mahabhutas.
Nice.
Thanks for that explanation.
Is that fair enough?
Yeah.
Very much. Jonathan, if I could just, tack on to that question, and as you said that some of the audience may not know enough about doshas, Dr. Joshi, for folks who are considering coming to the sessions on 17th, 18th, and 19th, do they need to have some prior knowledge about Ayurveda or prior knowledge of any other, basic concepts, or anybody can join that?
I think anybody can join us, to be honest with you, because we will be giving a basic knowledge.
Elaborating like easy way to understand the Ayurveda. Basically.
So if somebody does not have that information, they still will be able to understand it. That's what we want to do. But yes, if you have some background, if you learned something, if you went through some information, it will be good for you. It will make it a little easier to understand what is that means. We'll be avoiding more technical languages, technical words. I'm always love to use Sanskrit because that's the way only I learned Ayurveda. If I don't chant, nothing clicks to me. So I'll be keep doing that, or she will be keep doing that, but we'll be immediately translate that so that you know what I mean.
Makes sense.
So yes, for your question, I will say there is a basic book on Ayurveda by Dr. Lad. If you get a chance to look into it, it will give you a lot of information about how Ayurvedic principles work, what is dosha means. Or if you get a chance to look at my book or any other person's book, it talks about it. Dr. Chopra talks about it beautifully. So you can look into that also.
So Shalmali, what are you going to be presenting?
Yes, I'm going to present basically the woman's issue from puberty to menopause and different kind of variety of diseases, which nowadays we can see more than in 70s or 80s. Nowadays it is getting more and more those kind of diseases, which is very common, like PCOD, then fibroids, adenomyosis, or other kind of diseases, and menopausal diseases. So those kind of women's issue I'm going to discuss in my session. So that's what I'm trying to help. And but like in the with the help of Ayurveda, not the concept which is hormonal nowadays they are giving to the women's. So our goal will be the like how to balance the dosha, which Dr. Joshi just now mentioned. So balancing the three doshas and the cure, how to balance the doshas and taking care of the imbalance, which is like diseases we see nowadays. So that will help to understand the people how to do day-to-day basis simple few things like what to do with dysmenorrhea or menorrhagia, like those things I'm going to talk in that my session. So that's what I'm going to do. And after that, I'm going to do the diet, which is Ahara Chikitsa in Ayurveda, they mention, because root cause of all diseases is the diet, which is the food.
Absolutely.
So that need to be educated basically for everyone, not in US or any other places, but it's everywhere. The Ayurveda says the root cause is the ahar, which is diet, the food which we eat day-to-day basis and which nourishes our physical structure. So in that, if you eat imbalanced diet, that helps to uh, create the pathology. Like example, kind of if you eat wrong diet or whatever you eat day-to-day basis, which is because of pradnyaparad, we are eating wrong food. So it creates day-to-day basis pathology, and the 4 stages which Dr. Joshi mentioned, we cannot see that. But suddenly you can see the imbalances like either dysmenorrhea or endometriosis or fibroids, which is very common. 6 cases in 10, you will find nowadays these kind of diseases. And PCOD is a very commonly seen disease. So these kind of problems or imbalances, how to treat with doshic method, like I'm going to describe in my sessions.
So could you give us a little background about what drew you to Ayurveda and some of the most impressive things that you've found from being part of the science of life?
It's a question for Shalmali, right?
For both of you. You both.
You can't go scot-free, Dr. Joshi.
Well, I was trying to sneak out, but it doesn't work like that. But anyway, basically, we basically learned when we started practicing Ayurveda, that's where we felt that we are reaching to the point where we can able to treat the root cause of the problem rather than just alleviating the symptomatology. You know what I mean?
Yeah.
Yet otherwise, you are just making the efforts to reduce the symptoms, and then you're not changing your diet, you're not changing your lifestyle, you're not figuring out which organ or which system is really bottom line affected, and that's what it's causing it. And if you don't work on that, it will keep coming, it keep cropping up. And that is why working with Ayurveda, this gives us an ability to look deep inside of the physiology, whether it's a physiology, pathology connected with mind, or whether it's a physical body. We got to see a chance to learn root cause of the disease and get rid of the root cause of the disease. And that's where we found good results and get great results. And I think that really makes us happy. What do you think?
Yeah, definitely.
Yeah, because, I feel like that we don't need to just alleviate the symptom. We need to make them free from that. Once that happens.
Yeah, suppressing the symptoms is not a solution. But if you go underneath the root cause, that is going to definitely balance the dosha, and you can rule out that problem or root out the disease.
And, as just Jonathan, you were saying that understanding yourself, correct. That's exactly what about Ayurveda, to understand yourself, who you are.
Mm-hmm.
understand myself. That is okay. What is my constitution maybe? What is the doshic makeup my body holds? How is my body, my doshas are working? How they are affecting my physiology, my physical mental makeup or my physical functioning? How it is working on that. Once we learn that, we can take care of ourselves beautifully by understanding which ahara or diet can help particular doshas, which particular type of lifestyle can help us to get better. And I think that is where Ayurveda really focus on, and that gives us a immense satisfaction to treat patient. And I think we love that. I'm telling you, this is why it gives me a joy when I see a patient pain-free or symptom-free, not only symptom-free, but disease-free. It makes us happy. So honestly, yes, what makes us to do practice is because of this. And it is really our patients, our people who come to us when they undergo these treatments and when they felt better and they take a responsibility of themselves, they change. That encourages to keep doing what we are doing. And I think that really helped me to keep practicing Ayurveda. I honestly, in my personal remembering very early stage of my practice, I was very fascinated with modern medicine and I wanted to go into that route, to be a surgeon or a physician, something, a specialty branch I wanted to choose and I want to go for that. But my mother got sick with amoebic infection, which is very common in India. We call that amoebiasis. And that her amoeba invaded her liver and created a hepatitis also. And she was all swollen. She was admitted in big hospital in Nagpur, Government Medical College, Nagpur. And at that time, I was already so fascinated with modern medicine. I went to my doctor, head of the Department of Medicine, and I said, my mom is sick, admitted in the hospital. Would you please take care of her? He comes and see her and all that. And he takes me back a little bit. And he said, you know what? Your mom have a problem now. Her liver is inflamed and it's not functioning properly right now. And she's having all over the body fluid. And it doesn't look good to me. She may survive. She may not survive. I'm sorry, but I can't help you. Because in allopathy, there is no medicine for liver. My goodness, that was a very shocking news for me. I couldn't believe it. I used to think that, oh, this man is a great. He's fixing majority of the problem. And here he goes and he tells me he can't do anything for liver. Then I went to my Ayurvedic doctor, who was my teacher, that time, Dr. Katti. And he came to my home and visited my mother, saw her, examined her thoroughly, and gave her a very specific diet to eat and specific herbs and specific protocol. Then he came home and administered some bastis of the Panchakarma. You won't believe it. My mother lived 87 years after that.
Wow.
And I'm telling you this because I went through that. And that's where a turning point in my life. I said, no, I don't want to practice something where I have to tell somebody, sorry, I can't help you. I want to practice something where I can say, okay, let's move from here to the next step. I can help you. Provided you decide that you want to help yourself.
I'd like to ask you a question.
Thank you.
Dr. Joshi, in your book, you said about diagnosis in the Ayurvedic system, that you can diagnose a disease forming 30 years before it actually manifests as symptoms. And how do you do that? And, when I asked that question, he says, the pulse. So could you describe a little bit, because it's so unique. You won't see pulse diagnosis. Well, I think Chinese medicine has it as well. Yeah. But say a little something about that, because it really is
pulse diagnosis or nadi pariksha, we call that in our word, is not something completely unknown. It's a most known technique available till modern medicine era takes on. Because how we used to know inside the body. At that time, there was no stethoscope, no microscope, no gastroscope, no X-ray, nothing. Nothing was available to investigate. The only way we could able to figure out is to check the pulse. And what is the pulse tells you? The concept which I was just elaborating, Pancha Mahabhutas, that is doshas. So if you get very precise with understanding, analyzing doshas, you can figure out by checking the pulse Okay, where is the problem? Which dosha is affected? Is it Vata dosha is affected, Pitta dosha is affected, or Kapha dosha is affected? There are various permutation combinations of that investigation methodology. Honestly, pulse diagnosis is an extremely fascinating methodology for examining the patient. But Charaka was very clear at that time. He said that Nadi Pariksha is important, but along with that, don't forget to do whole physical checkups also. Shrotas examinations, examination of what is coming out of the body, and then make a assessment and then treat the patient. That's the way I learned in my medical school when I was learning there. But pulse diagnosis is an incredible thing, which initially was hard for me to figure out. I was able to just check their pulse rate, tachycardia, bradycardia. I used to understand their way of, pulsating them. But to understand the differentiate that doshas, recognizing the particular dosha concept, you need to learn about that, and it takes a time.
Yeah, it has like different kind of variety of like pulses, like Vataj, how Vataj pulse you can diagnose, or Pittaj, or Kafaj. Like these kind of diagnosis that time was happening because there was no parameters to judge the other like things like
Testing.
nowadays testings or any kind of sugar test or blood test. That time it was not there. So how they diagnosed? So because of this universe and this dosha, the 5 elements and the dosha imbalance.
So that is why understanding the concept of dosha is very important. If you learn Vata dosha, you will be learned about pulse diagnosis, how to approach. And then you have to do it. You will never learn in a one time. You have to keep doing it, keep doing it, keep doing it. It almost took me 10 years to just get into initial phase of understanding about pulse diagnosis. Now we know it. We got a definite clarity now about understanding the pulse diagnosis. But pulse diagnosis is the most fascinating tool which gives you way ahead. As I said, the seed which is so 30 years before, we can figure out that by checking the pulse.
Different slokas means
really
like different
fascinating.
systems, basically. Respiratory system or GI system, like these kind of, or urinary system or genitals, like any imbalance in that. So all that these kind of pulse diagnoses were done that time, imbalance, to see the imbalances in the body with the help of pulse diagnosis. So it takes time to learn.
But that is the real method. Means even today's cardiac surgeons, they can check, aortic wall regurgitation, mitral wall stenosis. Even by checking the pulse, they can figure out that. I know one of the topmost cardiac surgeon of the Liverpool, who I know very well. He is I think, probably 13th or 14th in the world, a surgeon. And he himself believe in pulse diagnosis because he said, with the pulse, I can figure out without doing echo, what's going on with the valvular situation in the heart. So it confirmed me that what we doing is quite close to what he's trying to figure out on the organ level. We go beyond that.
Very interesting. I think, in modern world, because of the usage of a lot many gadgets and, dependence on technology, a lot of us have lost the ability to listen to our own bodies, listen to the environment, listen to the messages that are coming from the nature, right? And, if we develop that intuition, develop that ability to listen to the messages, listen to what is happening around us, listen to what is happening within us, I think these things are surely possible. There are people who have, people like you who are showing us that, yes, it is possible. And I think, if we all can move in that direction, that would be such a great help for humanity and for people in general. Without taking too much time, I just wanted to narrate a folklore that I heard about growing up. There was a talk in my, at least in my circles there, that they used to talk about this Hakim, who is like a just like an Ayurvedic doctor, but a Unani
Unani, yeah.
method. But they used to talk about him that he was so good at pulse diagnosis. And you know, the way he used to do it for female patients was that they will be behind a curtain and they will
Yeah,
they will tie a small
Because of that
thing,
movement
right?
of that, yeah.
Right. So
Because of that movement of that thread, they
Yes.
decided, like, they diagnose the diseases.
Yeah,
Yes.
it's true. It's a
Right.
real, it's not story. It's a reality.
Right. So the story was that, you know, some people wanted to play a mischief on him, and what they did was that behind the curtain they tied this rope or that
Yeah.
thread to a buffalo instead of
Okay.
tying to a lady. And this guy picked it up and he said, "Why are you messing with me? Why are you tying it to a buffalo?"
No,
So
tapping in a vibrational energy, which is a prana energy, is all about diagnosis, pulse diagnosis. If you figure out that, you will know exactly where is the problem. Because prana is flowing all over the body and is telling you where is the issues, where it is choked up, where it is blocked up, where it is excessively working, where it is not able to work properly. He is giving you that information, and if you know how to tap that vibrational energy, that's all about it. And it's a science. I believe that.
very cool.
Honestly, when I started working on it, I was not sure about it because there was nobody there in the colleges teaching us about this. And when I went to this Nadi specialist Vaidya, he told me that you cannot learn that in the school or college. You have to learn on yourself and start working on yourself. These are the basic things. That's all I can teach you, but you have to explore yourself. And I went on. Today, I can say that, yes, I know now a little bit. I'm still scratching the surface. I'm telling you that.
So, Dr. Joshi, I understand that it takes about 20 years to master the pulse. And that might be an understatement, but
Exactly.
it's so complex. Now, I want to ask you and Dr. Shalmali a question. You've now been teaching and practicing in the United States for 32 years. So what's your impression of Ayurveda in the United States? What's your impression of the receptivity?
I feel good about it. I feel that Ayurveda is really getting solidified in the community, in the societies, in the people's consciousness, in the people's heart. People are open for that. People are hungry for that.
They're accepting. Basically.
They are accepting. And they are not just wanted to use this as a medicine. They want to use this as a life. So they can change themselves. And I think this is the plus point of practicing in United States, which I have found incredibly great positivity with the people who are coming to us. Means there are, say, out of 10, 2 people may not like to continue further. They just want some pills and medicines. And if they don't get it, and then they walk away. But there are majority of the people are not just coming for pills. Otherwise, a lot of people just looking for magic pill. Because, you know, if they don't get effect, they know that if you take an allopathic pill, which works like a magic pill, but it is a sword which has got 2 edges. One, it does a good, and 10 things it does a bad.
Yeah, they give
and people are now getting more aware about it.
All medicine with all, like, basically the indication and 10 side effects like that.
So this is why basically just taking medicine is not a solution. Solution is much more understanding yourself. And I think that's where I found United States is pretty open for that. The reason I was keep coming to US, it was this. It was very encouraging for us to help people because people are ready to take help and guidance and they wanted to go further. In fact, majority of the people were not even interested to take only pills. They want to know what else I can do without taking just pills. How can I take care of myself? Why should I drink warm water, or why should not I drink too much cold, or why should not I eat this particular type of foods and all that? It's all basically gives them an ability to control their own issues by themselves. And I think this is what about Ayurveda, to take care of yourself. Ayu means life, and take care of your own life. Veda means to know about your life. So Ayurveda. So I think know about yourself is what people are very interested in Western world. And I felt that was the most encouraging or motivating or inspirational point for me to travel all the way other side of the globe and keep coming there and doing the practice. And I think that was my experience. And what do you say?
Yeah, all these years we have done a lot, and we had really good time with Americans and USA. And receptivity wise, they were really good and following the everything like with what we said. And they are really good about the science, which I can express myself.
Yeah. Dr.
So it's
Joshi,
a
this,
good fertile land for that.
Dr. Joshi, this concept of a pill, having one effect and multiple side effects, would you say the same is true for Ayurvedic pills as well?
Yes. If you take wrong way, wrong doses,
Wrong medicine for
and not following the pathyam and just taking medicine, it will not work.
yes, side effects there are less because it is more natural herbal, so it doesn't have that side effects as the chemical has. So whatever
it
the chemicals,
has less side effects, but it still has some side effects. So
yes,
the best thing to do would be to work on your ahara vihara and your emotional stuff and your psychosomatic,
Exactly.
as Jonathan was saying earlier. But I mean, I'm sure you do prescribe Ayurvedic medicines or other interventions if
Sure.
it is needed, right?
Sure.
But the better thing to do probably would be to change your lifestyle, to change your attitude, to change your emotional build-up, and then not have to get to a point where you have to have any kind of medication.
But taken in the right dosage, there's generally no side effects with Ayurvedic medicine. Is that correct?
Absolutely. Absolutely. As long as you're taking correct way and correct doses,
Got it.
it never hurts you.
All right. There was one other thing that, Jonathan, if it is okay, I wanted to touch upon something that, I think, a lot of people on this call are very interested in Jyotish as a subject, right? And, that is something that binds us all, including Jonathan, myself, Meenakshi, I see a lot of other participants over here who are all fellow students of Jyotish. And we talk a lot about this concept of Nya, or the concept of, connecting to the, call it a higher authority, call it, universal, source of knowledge. And I think that's something that a lot of us do pay a lot of attention to, and feel that that's very important. I wanted to kind of just see that like Jyotish is supposed to be a Vedanga. Ayurveda is considered an Upaveda, I believe, right? So they are all sort of in the same family of knowledge systems, right? Do you have any thoughts, Dr. Joshi, that people who are already a student of Jyotish and are, let's say, getting started into Ayurveda, or have been studying both for years altogether, are there synergies? Are there concepts that can be taken from one field and then applied to the other, or vice versa?
Well, I think these are not actually separate branches. Ayurveda already have Jyotish in it, even yoga also in it. So as it is explained in our Charaka, Sushruta clearly mentioned, those who wants to practice Ayurveda, they must know at least little bit of astrology or Jyotish. They should know the principles, and they should know also yoga also. So they are not just only doing Ayurveda, means Ayurvedic medicine or Ayurvedic treatment. They should be fully understand the whole paradigm of understanding of Jyotish or yoga. So it is like that's where it can fulfill a person to get to the proper results of the treatment. And it is clearly mentioned in our Charaka that any therapeutic management is not just medicine or chikitsa. It is mani, mantra. These are the primary treatment, primary sounds, primordial sounds or primary vibrational energies, like I was just talking about, tapping the prana energy, pranic healing, which is people are doing nowadays. Or along with that, using the James or using the specific type of
According to Jyotish.
Jyotish. So for that,
Using the
you need
James.
to know basic knowledge about understanding the Pancha Mahabhutas. Because whether you learning Jyotish or whether you learning Ayurveda, Pancha Mahabhuta is a common breach,
It is.
which is nothing but doshas. So for me, when your question comes, I really highly recommend for Jyotishis who are practicing astrology or Jyotish should know dosha concept to help people at the base level, to help them to get better. Because there are many people are coming to us, for you, where they need some help and they can't find that help. And then that's where the configuration of planetary configuration and descending or ascending energetically the planets, this is all part of the Jyotish which you people doing it, but which is really helping, where it is affecting is the prana and doshas. And I think that's where, if we really know about doshas as a understanding as a Jyotishi, will be a better way to treat various type of problems. Whatever tools you have, you can use them. So I feel that yes, there should be a synergy between both of them, and there is I do believe that.
Very
What do you
interesting.
say?
Yeah, definitely. And I would like to tell about one thing, like the doshas or the Panchamahabhutas, according to that imbalances, they can wear like James kind of things, different variety of James. So that going to benefit with that problem or imbalance. So Ayurveda says Mani mantra, like this kind, and destiny also they have mentioned, karma, where you have to do some karma kshaya, then only you can go further. Or disease is also there, but you have to take care of Mani mantra and karma, which is Deva Vyapashray they mentioned in Ayurveda. So that thing need to be combined, then that person can be feel better or balanced. That's what my emphasis on this.
Surely, Jyotish is a science which every Vaidya should know, because when we make a chart, we know then which planet is holding the house and which planet is weak, which planet is strong. So that gives us some idea, clue to go into the direction of analyzing the doshas and go from there on the physical and emotional level and start further management. And I think I was working like that majority of the time with my patients. In fact, in Ayurveda, they says that if you want to give a very specific remedy for a patient, then use their Janma Nakshatra, their birth Nakshatra. Because sometimes you give a patient a treatment and if it doesn't work, then you better go for that.
Like
and you found the results.
Initially, our rishis used to, on specific nakshatra, they used to take the plant for the patient, like that. So at that time, they see the nakshatra time and everything, and they used to pray that plant that heal that person. So that kind of things also mentioned in Ayurveda.
Very interesting. So it's not just about, I think what it boils down to, or at least points toward, that it's not just about an individual, it's about a collective, consciousness, right? I mean,
Absolutely.
Okay, that's, wow.
It's a very nature-based system. And, in this world today, we're very cut off from nature. And so this science of Ayurveda seems to reconnect us with nature, with the plants, with timing, with the sunrise, the whole thing of living in accord with natural law.
Sure.
So it really is a beautiful science.
Yes. Even when they say very clearly that sun, which is a representation of Agni, as I was talking about Agni, which is expressing inside, the same Agni is available in the universe, and all the planets are moving around that Agni. And they all get affected or influenced by this Agni, which is nothing but a pure consciousness according to Ayurveda. It is the Atman, which is the self-consciousness, which is a universal consciousness, expresses out in the form of that sun. And I think that is very important to have that sun in our life. If that sun is not there, we know how you feel.
Yeah, there's no life without the sun.
Exactly. So as you know, the sun is so critical for us. Same sun is working inside of us. So if it is not working properly, how are you going to feel great?
Yeah.
How are you going to feel clear? How are you going to feel energetic, enthusiasm, the utsaha, natural enthusiasm? When you have a good Agni, automatically everything will flow with it. So yes, we do use these different mechanisms, like whether we recommend pranayama, whether we recommend mantra chikitsa, like vibrational, when we chant specific mantras, they are also creates a balance of doshas.
Mm-hmm.
So that is why it is very clearly elaborated in Ayurveda that dosha chikitsa is not just plant. Plants is the one treatment, but along with that, using mantras, using gems or money, or using a very specific time frame, or yoga asanas, whether yoga asanas, mudras, bandhas, they are all designed to work on balancing the doshas, which is Pancha Mahabhutas. If Pancha Mahabhuta get better, your Annamaya Kosha, your Pranamaya Kosha, your Manomaya Kosha, everything stay in a proper balance and in rhythm. And automatically disease process will not manifest. And they give a beautiful secret of healthy life and rejuvenation. They say if you want to rejuvenate your body, you follow this. You follow Agni, you will have a longevity, guaranteed. It is Charaka who said that.
And Ayurveda also uses yogasana for
Absolutely.
the treatment of specific doshic imbalances.
Exactly.
Yeah.
So every asana is not good for everybody. It's like when you analyze a person according to the chart and decide about particular mantras or particular therapies, like that, even asanas has to be designed, which asanas to be given to that particular set of patients, or mudras or bandhas. Even pranayamas, there are different types of pranayamas. Everybody be doing everything is not recommended. Precisely according to your dosha makeup, dosha balance, you can use it. And I think this is what you can learn from Ayurveda. Nobody talks about it.
Wow.
May I tell you, it's very fascinating how much I'm getting into this. I'm learning every day with the patients. It's like incredible experience for me just to learn about how one particular thing can help patient to get better. So that's where I realized only medicine is not a treatment, which is what, unfortunately, as a disciplined doctor, when you get into the practice of medical practitioner, there's a design inside of you that I'm supposed to prescribe medicine. That is the least thing you do. Most importantly, you do is to figure out what else to do. And that's what I learned from Ayurveda.
The modern medicine is really good. It's helping everyone. It's not like that, but to prevent the diseases, what to do, it mentioned in Ayurveda, which is preventative medicine, basically. So that helps to balance the three doshas and balance the body.
That is really profound, Dr. Joshi. So for folks who want to kind of understand how to live a better life and kind of or are struggling with things where they need some help, you will be here at Ayurveda Gurukulam on 17th, 18th, and 19th of June, and there are some slots available for people to book for a consultation with both you and Dr. Shalmali. So I would encourage everyone to go to jyotish.com website, or they can reach out to Meenakshi if you have her contact details, and she would be able to help you with any consultations. But you also have the centers in Albuquerque and center in Nagpur. I think where people can go for longer treatments, right? And the
Sure.
flagship program there is Panchakarma, if I
Yeah.
understand it correctly, right? So I would again encourage everyone to look at the website, and you know, if you have any questions about that, you can reach out to Dr. Joshi directly about that. I will be definitely looking forward to do my own Panchakarma sometime soon, Dr. Joshi. I think, you know, the time
You're
has come
welcome
that
anytime. Yeah.
I should think about that. So as you said, you are more of a practical, you know, a practicing, you know, Ayurvedic clinician or a doctor, right? I had a question around that. I mean, you know, as much as we say that, you know, the modern lifestyle and the modern science, modern medicine, you know, has been sort of, you know, is a little bit of a culprit in, as Jonathan said, you know, moving us away from the nature. It does have its own place. You know, it did help us in taking care of or preventing infections, preventing diseases which are caused from outside. It's also very helpful in acute issues where you need to take care of things in a very short amount of time, and you don't have enough time to do course correction through natural means. Where do you see, Dr. Joshi, you know, the modern medicine, the modern science, and the ancient knowledge, what today we call as the alternate, you know, medicine, which I find to be very unfortunate, because just 200 years back, what we call our alternate today was actually the main, or was the only thing available to us, really, right?
Correct.
So how do you see the two coexisting, and what do you suggest to your patients who come to you and obviously cannot completely live, you know, a life which was as it was 200 years back? Obviously, nobody, none of us can do that. So, what kind of balance or what tips do you offer to your patients?
Well, you know, basically, if you look as a medical history or as a information, previously when allopathy was not available, like antibiotics not available, all these very important medications which has really stopped communicable diseases, because that time death, mortality was basically because of the communicable diseases. People were dying. Cholera comes, wipe off the whole community, or dengue, or malaria, and cholera, or name it, any type of tuberculosis. These diseases were killing people. And that's where this Western knowledge came up with treating the bugs, killing the bugs, and making systems free from them, help to sort of get rid of the disease so that body can heal and start working and functioning better. And I think this is where allopathic system has done fantastic job. And I respect that. That is why now see what happened. Previously, people used to die because of the communicable diseases. Now people are dying because of non-communicable diseases. You know, which is the monster disease today? Hypertension, diabetes, insomnia. I mean, you name it. These are all non-communicable diseases, but there's no treatment in today's modern medicine for that. Conservative treatment. If you got blood pressure, take a pill. And patients are so sweet. They tell you, Dr. Joshi, when I take a history, you have any issues? Oh, I do have a little blood pressure. I take a very small puppy, a small pill, and I'm fine with that. But they don't realize that puppy is a very strong medicine.
Yes.
It's a strong chemical,
yes,
which is creating some benefits and some negativity also. It's in fact creating more problem for you eventually in the future. So these people, you can see their histories. They get into one medicine, oh, beta blocker, then they need to do calcium channel blockers, then they need to do anticoagulant, blood thinner. It's like one after another chain of medication goes on. So what really needed to happen there is understanding the lifestyle and diet and balancing the doshas. That helps you to free from those drugs to keep depending on. And that is why I think that I never say allopathy. In fact, if I got a heart attack, I'm the first one to run to the hospital and get my heart attack stabilized so I can survive. Yes. Because now we got a medicine for that. Mm-hmm. When old time, there was no such a treatment available. When we don't have opening the coronary arteries with we do have herbs to help that, but not like instantly. But now today's this angioplasty, invasive treatments, they work very quickly. But what is the role of them? Just momentary. It should not happen again. There's no treatment for that. So that's where Ayurveda is the answer. Where we can tell you that why this happened, and if you don't want in the future to get another heart attack, what you should be doing. A lot of people are not knowing that. That's the problem. People goes through bypass, angiography, angioplasty, all kind of problems, and they go to doctors every 6 months or get checked up, and they think they're fine. They're not fine. Disease is progressing further. There are many people who are doing CABG, like coronary artery bypass graft, CABG, and then they have to redo that again. They have to repeat that procedure again because it gets blocked again. So I think somewhere down the road, allopathic system has fantastically helped to treat communicable diseases and infectious diseases. Of course, that's where it is really given their wisdom has helped us immensely. And otherwise people can die in masses like today COVID, is really fantastic to go through this whole period of COVID. But what was it taught us? That if your internal environment inside is not appropriate, COVID will manifest so quickly and it will kill you. But if your own immune system, if your Agni is good, if your prana is good, even COVID gets inside, it can get killed and you will be survived. You'll be fine. And I think that's where Ayurveda works. So yes, I do respect allopathy and I do respect for their benefits. And that's why we know our limitations. We tell patients, this is where I'm good. This is where I can't work. If you need a surgical evaluation, surgical treatment, I'm not going to involve into that. You go to the doctor, get taken care of it, and then come back to me so that it should not happen again. As Shalmali was saying, prevention. So that is where Ayurveda works. But yes, allopathic science is a fantastic science, has helped us to get out of the infectious diseases, and mortality has significantly went down because of that. So I do support that. But again, that's not my forte. So if I have somebody infection, I'll send it to my friend doctor, take care of that.
So if you have an acute issue, you have an emergency, you have any urgent issue to take care of, use the right tool for that, which is allopathy. But you have a health baseline and you want to change your health baseline and to elevate the baseline on the longer term, then yes, you need to work with more natural ways, and you need to
where you need to look holistically how to deal with the issue at the root cause rather than alleviating symptoms.
Sure.
And I think that's where Ayurveda is phenomenally supports. Whether it's today's monster disease, diabetes, high blood pressure, we have a good answers for that. We have a good treatments for that, provided you need to take participation in that. Just taking pills is not a participation. Doing the dietary restrictions, doing the lifestyle restrictions, following the specific routines, I think that's really makes you better and better.
Fair enough.
So in your book, you mentioned that, and you just had mentioned holistic, and that Ayurveda, it starts with the body, but it connects mind, body, emotions, and spirit.
Correct.
And that that's why it's holistic. It takes everything about human nature into account.
Well, the definition itself is explanatory, because what is Ayurveda? Ayu means Sharira, Indriya, Sattva, Atma, Sanyoge, Dhari Jivitam, iti Ayuhu. What does that means? That physical body, which is Sharira, Indriyas is your sensory apparatus, your physical sensory apparatus and your functional senses. And then your mind, beautiful mind. And finally, your Atman, your soul, the one which is the awareness, the one which is controlling the whole link of Ayu. So these are the four components makes the Ayu. So Ayurveda, whoever practicing Ayurveda should know all these four components. Sharira, Indriya, Sattva, Atma. They should know all four components. They should know what is that means. And Atman and mind are the most critical one who is controlling the Indriyas and Sharira, the physical body. Sharir is a Sanskrit word for physical body. So definition of Ayurveda, self-explanatory. It says that you basically look more holistically into understanding of yourself. So it's not all about physical body. Who controls that? Is the Atman. Final commandant in charge is that Atman. And it's so beautifully elaborated in Charaka about concept of Atman, concept of mind. I think that's something is very, everybody can learn about.
Very interesting. I would also like to open it up a little bit for the participants. If anybody has any questions and you want to unmute yourself or you want to put your questions in the chat. Also, there is a live streaming going on YouTube. So those of you who are watching us on YouTube, if you have any questions, please feel free to drop your questions in the chat. I'm monitoring that and I would be happy to take your questions over to Dr. Joshi. So please feel free to unmute yourself or put your questions in the chat.
Namaskar, this is Vijay.
Namaskar.
Enjoyed your presentation thoroughly. One quick question I had was, I put it in the chat. You talked so much about the Nadi Pariksha. Have there been situations where you saw something in the Nadi Pariksha, but that kind of misled you and it was something different than what the Nadi was telling you?
No, that's why I told you that we don't only depending on Nadi Pariksha. We do Shrotas examination, clinical, systemic examinations, number one. Then we check what is coming out of the body also, whether it's a urine, whether it's a stool, whether it's a sweat, whatever coming out of the body. We need to see that, how it is looking, how it is working, because that expresses you what is going on inside. So it is clearly mentioned in our text that as an Ayurvedic practitioner, you must know doshas, dhatus, and malas. All three things you need to examine and then make a final conclusion. Just don't depend on pulse. As you correctly said, it can misguide you. You want to be careful about it.
There was a little chat there about fermented foods. The entire southern part of India does idlis and dosas. They're all fermented foods. So
Yes, sir.
Is there a problem with that?
Absolutely no problem, as long as if you don't have that process inside the gut. If your Agni is strong enough to digest that food, you're fine.
Okay.
But if your digestive fire is weak, is not digesting that food, then that food which is undigested is going to stay there, will not be absorbed to the gut. So it has two choices, either go out of the body, and if it cannot, then it stay there and get rotten. So it will get fermented. So then that fermented food will kick bloating, gas, acid, and it's a beautiful environment for the bugs to grow. That is where we have an issue. We said we don't want that fermented vehicle available there because that will keep cropping up then acid, which is what turned into acid reflux then.
So no alcoholic drinks.
Exactly. So if you have that issues, then we say restrict that food. But if you don't, you are fine.
Thank you.
You're welcome, sir.
All right. Any other questions from anybody?
There's one in the chat.
About the yogasanas?
Yes. It's a fairly extensive
Yeah.
answer. So
Dr. Joshi, the question is, specific yogasanas for specific diseases, and I am just sitting here thinking that probably not enough time to talk about that, and it may also be a better question. Yeah, it may also be a better question to take to a yoga therapy class rather than an Ayurveda class.
Exactly.
So,
there is a whole treatment called Vihara Chikitsa explained in Ayurveda.
Kalpana ji, I see your question there. The contact information is available on the website, jyotish.com. Please do get in touch with Meenakshi. She will be able to help you out with whatever your needs are. And Dr. Joshi's website also, I'll try and put that in the chat.
I'd like to, since Dr. Joshi talked about suggesting that people read something on Ayurveda before the class, it might be helpful. This is Dr. Joshi's book. It's called Ayurveda and Panchakarma, The Science of Healing and Rejuvenation. And it's available at Amazon, through many bookstores, and Dr. Joshi's clinic in Albuquerque.
Awesome. Thank you, Jonathan. Yeah, I was trying to search for the link as well. Absolutely. That would be awesome. All right. So unless there are any other further questions, we are reaching towards the end of this session. I think, we have taken a lot of time. It's getting late back in India for Dr. Joshi and Dr. Shalmali. So unless there are any other specific questions, we would like to start moving towards closing this session.
Saurabh, there is a question from the YouTube cast. I am in the chat right now.
Sure. Okay. The question, Dr. Joshi, is there any treatment available in Ayurveda for depression and anxiety?
Absolutely. There is a whole lot of treatment explained, elaborated in Ayurveda, because anxiety and depression, these are shades of emotional expressions of mind. So if you learn how the mind works, and that's what I'm going to talk about it in the class. And also, if you learn how the food nourishes your mind, and if you start working on the food habits, it can help your fight against the anxiety and depression both. Plus, we do recommend some herbs if required. So we do have a very successful treatment for these two monster diseases, which I see very commonly with people.
Yeah, with the food, I would like to advise some yoga, which is pranayama and meditation, of course. So these kind of things also you can incorporate with this kind of problems.
I would, in fact, double down a little bit on that and say, like you said, Dr. Joshi, these are non-communicable diseases, right? These are what they call as the adhija vyadhis, right? They originate from within, right? So, I mean, I would say that, if anything, it's Ayurveda, it's yoga.
Can help.
Because the modern medicine, again, is very good when it comes to things or issues that originate from outside. But when it comes to issues that originate from within, including cancer or diabetes or hypertension or anxiety or any kind of a neurological disorder, I think it's these alternative medicines which are probably the go-to toolkit, right? Well, there is one more question. Will Ayurveda help me in rebuilding the cartilage in the knee? I have been told the knee is bone on the bone. Only solution is knee replacement. Can Ayurveda help?
We get these patients all the time in India, and we work with them. Because again, it's all depending on a patient's attitude, that if they want to ready to work more natural mechanisms to rebuild, answer is yes, we can work on that, because Ayurveda says rejuvenation is a natural procedure. That is the definition of physical body. When we call Sharira, means an entity which is constantly rejuvenated. So yes, your cartilage is supposed to rejuvenate. In that particular age, when your cartilage cannot rejuvenate, which is called the age of Vata, I'll be speaking about that in my class. That if you know how to manage the Vata dosha, you can rejuvenate the cartilages. Provided if it is you do properly and you come to the doctor at a specific time frame. But if you are on bone to bone and you lost already a bone also, then there is a very little left to do. So that depends on the stage of the disease, as I told you. If I get a patient at a 5th stage, I can still work with it. But if I get a patient at the 6th stage with the complications, then it's a maintenance business pretty much.
And I mean, even maintenance is good enough, right? I mean, that's what.
Yes, of course. I have a patients who are practically walking with the sticks and walking with the walkers. Get rid of that, and they're able to handle their pains very easily, and they are fine.
Yeah.
Because they don't want to go for a knee transplant or operation. So they said, we are ready to do whatever you say, and we help them. So yes, we do have a treatment for that.
Very fascinating. Very fascinating. All right. So yeah, I think, if there are no more questions, I don't see any questions in the chat. So thanks a lot, Dr. Joshi, Dr. Shalmali, for spending time. I know it's getting very, very late in India. So thanks a lot for staying with us. Jonathan, as always, please,
My pleasure.
accept my gratitude for being here and sharing your experience with Dr. Joshi and, talking about, your journey with him. Dr. Joshi and Dr. Shalmali Joshi will be available on 17th, 18th, and 19th at Ayurveda Gurukulam. If you want an appointment for consultation, please visit the website jyotish.com or reach out to Meenakshi at ms@jyotish.com. We would be very, very happy to have you join us in person for the 3-day sessions that we're having at Ayurveda Gurukulam. But if you're not able to travel, there is live streaming available. You can watch it online. We try and make it very, very interactive for people who are online as well. If you are, like you are doing it right now, you can unmute yourself, talk to the presenter. You can also use chat, and we have been doing it for some time, so we have some experience doing it, and we feel that obviously being in person is the best, but if you are online, you will still get a lot of benefit out of it. So please consider doing that. And with that, once again, thank you everyone for joining. Thanks for those who are watching us on YouTube as well. And I would just do a quick closing mantra, and then we'll close the session. So please bring your hands closer to your chest. Take a deep breath in. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kaschid Dukkha Bhag Bhave. Om Purnamada Purnamidam Purnat Purnamudachyate, Purnasya Purnamadaya Purnamevavashishyate. Om Shanti Shanti Shanti. Hari Om. Om Tat Sat.
Thank you,
Thank
Dr.
you.
Joshi.
Thank you so
Thank you,
much.
Sara.
Thank
Thank you,
you.
Jonathan.
Thanks,
Thank
Meenakshi.
you. Namaste, everyone. Bye.
Thanks, Jonathan.
Thanks, Jonathan.
Yes.
Thank you,
Thank
Meenakshi.
See you soon.
Yes.